Today, we are discussing all things holistic dental health with Dr. Sanda Moldovan. If you've ever wondered if there is a connection between dental, mental, and gut health, you do not want to miss today's conversation. Welcome to C60 Health Connections, where we meet with leading experts who can help you elevate performance in all aspects of your life. Dr. Sanda Moldovan is with us today. She is an award-winning, board-certified periodontist and licensed nutritionist who believes that a gorgeous smile emanates from the inside. Her philosophy is that good nutrition, natural supplements, and at-home dental care play a pivotal role in chronic disease prevention. While healing her patients' oral health issues, Dr. Sanda encourages head-to-toe nourishment for enhancing overall wellness. She is dedicated to being an advocate for people worldwide to treat their mouths and bodies as one entity, like nature intended. Dr. Sanda stays on top of the latest research and technology in her fields of expertise, particularly microbiology and nutritional science, to support healing. She serves on the advisory boards of Nobel Biocare, the nation's leading implant company, and BioLace, the global leader in the global leader in laser dentistry. She is a widely sought after, internationally acclaimed speaker for her integration of nutrition and dentistry, and as an expert in oral health. In fact, you might have seen her on TV before because she is the go to expert on oral health for the Emmy award winning syndicated daytime television show, The Doctors, and she is also a published author. My name is Jessica McNaughton, and I am the CEO at shopc60.com and C60 Purple Power. Now, before we get started, any statements, products, or topics discussed today have not been evaluated by the Food and Drug Administration. Anything we discuss is not intended to diagnose, treat, cure, mitigate, or prevent any disease. So, Sanda, so great to see you today. Thank you so much for joining us.
Well, thank you, Jessica. I'm really excited to answer any questions about biological dentistry.
Oh, wow. Well, this is going to be a fun conversation. I've been really looking forward to connecting with you. Um, Before we get started into all things dental health, can you please share with our audience a little bit about your background? As I understand, you emigrated here from Romania and you have been a public speaker since you were a teenager. So, will you tell us a little bit about that?
Definitely, and it's amazing to me how things have a way of serving us later on in our life. So when I was 13, 14, I was the leader of my school back in Romania, and we constantly had to have meetings and really talk publicly. And that kind of primed me for what I'm doing now. So when I was 14, we immigrated to the United States. But while living in Romania, I learned so much about natural health from my grandparents. And I learned things like composting, organic gardening, herbs that are healing. And at the time, I was just making a mental note, but I didn't really get to apply those until later on in life, 20, 30 years later, when I started becoming interested in nutrition. And I ended up writing a book called Heal Up. That's basically 7 ways to help with healing. And it includes a lot of my, tips and tricks that I learned from my grandparents, as well as scientific research of how we can heal without medication. So that's, where we are today. I have a couple of practices that are geared towards natural biological dentistry. And we teach people how the mouth is related to the rest of the body, how to pay attention to different signs and symptoms, and how to basically reverse them by being nutritionally fit, using the right supplements, or sometimes, could be sleep, could be more water. It doesn't have to be supplements. Those are very, very important parts of healing.
Wonderful. Well, this is going to be a lot of fun. Thank you for explaining that to us because we're big advocates for sleep and water too. It's critical and super important. So, hey, let's talk about just some of the basics because I would love to empower our listeners with simple, tips on, what they can do to support their overall health and wellness and specifically their dental health. So maybe you can talk to us just a little about what are some of the basic fundamentals that you think are most critical to support dental health.
Well, I always say that the three steps to optimum oral health are good brushing, water flossing, and a chewable probiotic to support your microbiome. And brushing is important, and you don't have to use a fancy brush. The most important thing, you want to brush right at the gum line. Our mouth has 600 different types, species of bacteria that form what is called a biofilm, which is a layer of microorganisms and proteins and saliva that basically coats your teeth, it coats your tongue, it coats your cheeks, your throat. And we need to keep this layer to a healthy level. And notice I'm not saying destroy it all, because a lot of people use a lot of antimicrobial. Oh my God, I got to brush my teeth really hard. I got to clean all this bacteria. You're never going to win this war because, as we know, we're 10 times more bacteria than human cells. So we have to learn to live symbiotically with our bacteria. So for that reason, we want to keep this biofilm level to a minimum by brushing correctly, using a water flosser. And basically, why water flosser? Because most people don't use string floss. Or if they do use string floss, they actually will cut themselves. They don't use it correctly. You don't wrap it around, like a C around the tooth and make sure you kind of get all the corners. So we find that a water flosser works much better to control inflammation and prevent gum disease and cavities. And thirdly, with prevention for dental health is a chewable probiotic. And disclosure here, I started a company that has natural oral health products, and I was involved directly in the formulation of this a vegan certified chewable probiotic. And the reason why I'm so passionate about it, because all the research showing today that we can prevent cavities by using friendly probiotics, we can decrease inflammation in the mouth and in the body by using probiotics. So, I'm a big fan. So,
cool. Will you tell us where we can find it? And we'll pop up the link right here. So what's the address that we can find this probiotic?
It's at orasana.com, ORASANA.
Okay, perfect. We will pop that up here. All right. Will you tell us a little bit about what's your perspective on fluoride, whether that be fluoride in your toothpaste or fluoride in your water?
So I'm not a big fan of fluoride used in the mouth. Number one, there's not enough studies to show that fluoride actually helps the mouth. There's a lot of data showing how fluoride ended up in the water. And fluoride is actually also used as a pesticide on the fields. So in high quantity, fluoride is toxic. Most of us are not prone to cavities. So using fluoride toothpaste day in and day out is not something that's recommended. There's different ways to treat cavities other than fluoride, or sensitive teeth for that matter, is actually using nanocalcium. In our practice, we don't do fluoride treatments. We don't find them beneficial. There's not good studies out there to really, support that recommendation. There's, however, studies to show that children from grades 5 to 8 who are ingesting fluoride have a lower IQ.
Really?
Yes.
Wow. Okay.
So I'm not a proponent, in the 80s and 90s, the pediatricians used to give to children fluoride tablets. That's not being done anymore because the effect is having on the development, of the brain.
Geez, that would be really unfortunate to think that you're doing something good and in fact you're lowering your child's IQ. That would be really unfortunate.
Yeah. Plus, if you have something called fluorosis, meaning the over intake of fluoride, it causes brittle teeth. So it actually has the opposite reaction of what we wanted to have. So
Wow.
No fluoride that I recommend.
Okay, let's talk about toothbrushes. Do you recommend an electric toothbrush or just a regular toothbrush?
Good question. I recommend whatever works for somebody to clean and maintain their plaque level to a minimum.
Okay.
Because some people are really bad at using an electric brush. I see a lot of plaque, so not everybody knows how to use one. Some people are great at it.
Is there a special skill that you need to have to use one properly? Like what should you do besides turning it on and putting it in your mouth?
Right. I think the skill is being conscious where you're putting the brush, right at the gum line. Because if you just put it anywhere, it kind of doesn't work. And actually, interestingly enough, the frictional electric brushes that rotate
Mhm.
actually can cause recession. So
Okay.
those are something that I don't recommend actually, especially for people that already have gum recession. So using
Okay.
a fine manual brush or like a sonic type of brush is okay.
What do you use and what do you personally recommend when people are like, "I love the way your teeth look. Tell me what you're doing."
Yeah, I mean, I'm partial to our Orasana a hand the toothbrush,
Okay.
manual toothbrush. The reason being, the way I designed those bristles are very, very fine. So they actually sweep underneath the gum where bacteria can also lie, a good 3 millimeters. And it cleans very gently, but without really traumatizing the gum line. They're
Okay.
also infused with charcoal. So the charcoal infusion in the bristles uh, create this negative charge on the bristles. So it actually attracts the positive plaque. So it cleans better.
Okay. For people that are young and in love, I think this is for those folks. Um, what's your perspective about people sharing a toothbrush?
Yeah. Well, I've actually spoken about this before. So what happens when 80% of people bleed when they brush their teeth or when they floss?
Really? 80%?
80%, yes.
Wow.
So what happens is if you're going to use a toothbrush and now you have some, let's say, viral blood particles on your toothbrush, such as, I don't know, could be Epstein-Barr virus, could be herpes virus. Now you're taking that brush and brushing yourself and bleeding again. Now you're introducing viral particles into your bloodstream. So I don't recommend it for that matter. And I think viruses are more dangerous in transmission from toothbrushes than bacteria is.
Yeah, so not a good idea.
Not a good idea.
Okay, good to know. What is your perspective on regular kind of conventional mouthwashes? Are these a good choice or a bad choice?
Great question. I'm not a big fan of mouthwashes to be used long term. So the reason for mouthwashes is really to give you that good feel, like that clean. So if you like one, by all means use it as long as it's not doesn't contain alcohol and it's not harsh, like contains harsh chemicals such
Mhm.
as chlorhexidine, for example. Chlorhexidine, again, it's a pesticide in the field. It's used oftentimes to control gum inflammation. I don't recommend it at all. So if it's a homeopathic wash that's alcohol free, and you like the taste of it, by all means, use it. Typically, in our practice, being a periodontist, I recommend mouthwashes for people that have gum disease, that are in treatment, that have an actual condition. But for everyday health, a mouthwash is not really necessary.
So, and what's your thought on the connection between the good bacteria that you want to maintain in your mouth and in your gut, and if you're using a mouthwash, what's your perspective on that?
Good point, Jessica. If you have a mouthwash with harsh chemicals and fluoride, especially, it's going to basically kill the friendly bacteria and that's in your biofilm and promote the growth of pathogenic or disease causing bacteria because typically those are more resistant. So, and the other thing that I don't like, Listerine, for example, has alcohol, most of it has a pH of 3.5, which is very acidic. So it can actually cause, if used, let's say, excessively, can cause dissolution of enamel in sensitive teeth, even if it's at a microscopic level. So alcohol mouthwashes are really not recommended also for that.
Okay. That is very interesting. Thank you for sharing that with us. Can you talk to us a little bit about bad breath? What causes it and what can we do about it?
There's many reasons why we have bad breath. It could be a mouth problem. Let's say maybe an abscess in the mouth from a tooth. It could be gum disease. But it also can be a digestive problem because the mouth is the opening of the digestive tract. So, if you have, for example, you stick your tongue out and you see a white coated tongue, some people get a bad breath from that. And that's really, if you see a white coated tongue, you might have a yeast overgrowth or bacterial overgrowth. And about 60% of bacteria in the mouth can reside on the tongue through the papilla. So, definitely kind of, if you have bad breath, kind of look in the mouth, check your gums, look at the tongue, and then if that's not a problem, then it might be like a overgrowth of bacteria that's farther down in the GI tract that actually comes out through the mouth. What's interesting is also people who are constipated may have bad breath because everything backs up if you're constipated. It's a very big problem, actually. I remember one time I had a patient, and I was asking her, which is typical for me to ask, if you're constipated. She's like, yeah, I usually go to the bathroom every third day. And she thought that was normal. But she was also suffering from gum disease. So, I explained to her that, if we have constipation, that all the toxins are backing up in your body, you're not able to detoxify, and it's going to cause bad breath, perspiration and body odor and other things, which are really a sign of toxins.
Wow. And what's your recommendation to address that? Is it to work or to utilize probiotics to and drink more water, or are there other things that people should be really aware of?
Definitely. So we have a holistic approach, of course, like everything else that we do. So for the mouth, definitely starting them on, the correct brushing, water flossing, and a chewable probiotic. And what we notice with the chewable probiotics is that on a coated tongue, you don't actually need to scrape it. Just by using the chewable probiotic, you actually can revert the tongue to a good health. But also, we have a botanical supplement that I really like that helps to detoxify the remainder of the GI tract because that's very important part of the bad breath. I think
Okay.
just using a mouthwash is just not going to cut it.
Okay, that's good to know. Now, what do people who are suffering from or who in the past have suffered from eating disorders need to know about their dental health? Because I understand from the work that you've done that this is something that you see quite frequently with people who've had some eating disorders in their life. That there's some issues with their dental health.
Yeah, so I always say the mouth is the gateway to our health and it shows us signs of what's going on with us. So we actually diagnose a lot of the eating disorders in the dental office because we look at the back of the teeth and people, let's say, who are bulimic, we can see that the back of the teeth has been eroded from the acids. So teeth become more sensitive, they become more brittle. And of course, we can help with the teeth side of things, but really helping them with resolution of that eating disorder is important.
Okay, that's good. What are some of the initial steps or recommendations that would be key for people to know about if they're interested in recovering from an eating disorder?
So, in order to keep your teeth healthy when you have an eating disorder, is very important that the acidity in your mouth is not high. So, you can measure that. For example, you can buy some litmus paper online or at a grocery store, and you can test your saliva. If your saliva actually drops before under 7, and especially like 4 or 5 in the pH level, it will dissolve your teeth. You're going to wear off the teeth at a faster rate. And you can do something about that. You can start drinking more alkaline water, kind of rinse your teeth, if you are throwing up or you're having GI problems. You can use nanocalcium in order to strengthen your teeth after exposure to acid. So these are all important things to do in order to protect the teeth from breaking down.
Okay, thank you. For folks who have metal fillings in their mouth, what do they need to know? Like, can they leave them there? Should they find somebody like you who can help them remove these safely? Can you give us a little education on kind of like how the trend with the metal fillings has evolved over the last 20, 30, 50 years?
Yes. So I can definitely give you a lot of information about that, not only from a professional experience, but also from personal experience. I grew up in Romania and I ended up with 16 large, what is called amalgam fillings or silver fillings, which are typically about 50% mercury. So, the problem with mercury fillings is that they over time they expand and they crack teeth. So, and you can't really see when we take an X-ray whether or not it has a cavity. But I have to tell you, almost always when we take out corroded silver fillings, there are cavities underneath. And for me, unfortunately, I didn't have these fillings removed safely. I just wanted them removed, so I didn't have a mouthful of metal. And I ended up with mercury toxicity from inhaling the vapors that came off the fillings as I was having them removed. And I didn't know, like, all of a sudden I have headaches, I'm tired, what's going on? So it took me a couple of years to actually figure out that I had high mercury in my bloodstream. And I had to undergo chelation, which actually in itself took some time to get that mercury level out of my body. Plus, I'm sure some of this mercury accumulated for me every time I ate something hot, every time I brush my teeth. There are studies to show that slow amounts of mercury are coming off these fillings as we go through everyday life. So once I had them removed, I began the chelation process and it took a while. So I highly, highly recommend to you not to have just anyone remove these silver fillings because of the high mercury content. Go to an IAOMT certified dentist, biological dentist who knows to protect you from inhaling the mercury.
So for those of us that don't know, can you please explain why mercury exposure is so dangerous and toxic for humans?
Oh, yeah. Mercury is a neurotoxin. So it actually binds to anything that's fatty. And of course, the brain and the nervous tissue is fatty. And also, for those of you that have high levels of heavy metals, such as mercury, might not be able to lose weight because it's getting stuck in your fatty tissue. So it's important that you get this diagnosed by a naturopath or a medical doctor via a urine challenge test. We find that that's the most accurate and get the fatty tissues to release the mercury. And eventually, this is a process, it doesn't happen overnight. Your neurons and your brain tissue can recover. But brain fog, headaches, depression is very common with mercury toxicity.
Okay, good to know. Can you talk to us a little bit about chewing food? If we are fast eaters or if we are slow eaters, what should we know about chewing food?
Great question. And that's an unusual one. Essentially, the mouth is the opening of the GI tract. So that's why it's important that you have a full set of teeth for those of you that, maybe don't and you're on the fence about replacing some of your teeth. What happens is we need to break down our food. And our teeth are there to break it down so that, we can absorb these nutrients farther down in the intestinal tract. So we say we have to chew about 40 to 50 times the food before you swallow it. The other thing that happens with saliva in the mouth is that you have amylase, which is a enzyme that starts to break down the food so your nutrients can be properly absorbed. And for those of you that eat too fast, you may find that you get bloated because the digestion really begins in the mouth. So it's very, very important to allow the protein, the salivary protein and enzymes in the mouth to blend with your food so it could break it down before it reaches the intestinal tract.
Okay. This is gonna sound weird. And I didn't know this was a thing. It makes me think of like mama and baby birds. But apparently it is a thing with some celebrities. Chewing food, taking it out of their mouth, putting it in their baby's mouth. So what's your perspective on a mom who would pre-chew food and then give it to her baby while she's trying to transition from either breastfeeding or formula into, solid foods? Can you talk to us a little bit about Is that a good idea? Is it safe? Is it a really terrible idea? What do you think?
It's a good idea if you have checked your microbiome, right? Your biofilm in the mouth, and it's healthy. The worst thing you can do is transfer periodontal bacteria to your baby. Because what happens when you chew food, bacteria will come off the biofilm and it's going to become populated in the baby. As a matter of fact, we think that's how we inherit our microbiome or the biofilm or the bacteria present in and on our body, but especially in our body. So, part of our biological dental practice, we have salivary diagnostics. So, people that are suffering from inflammation in the mouth, we do a saliva test. This saliva test, basically, you swish, you spit in a test tube, and we'll be able to tell what kind of disease-causing bacteria you have in your saliva. I highly suggest that if you're planning on sharing food with your child, you do this test first. It's by a company called Oral DNA. And a lot of us actually have bacteria that causes aggressive or moderate gum disease. And what's worse, some of this bacteria can populate, the brain, can actually cause rheumatoid arthritis, heart issues, inflammation in the body. So it's not just staying in the mouth. So I think by sharing food without actually knowing our oral condition can do more harm than good.
You've already talked about brushing and using a proper um, flossing technique, but what else is important for protecting your teeth and having a great smile?
Well, what's important to our teeth is to protect them also from clenching and grinding, right? And a lot of us have so much stress today, changes in the world and the way we're interacting with each other. And what I've seen in my practice in the last couple of years is a lot of stressed people that are clenching. So, what happens during clenching? Our muscles on the side of the face actually are very strong. And yeah, you might wake up in the morning, oh my God, my jaw is so sore. You start massaging it. But what are you actually doing to your teeth is creating micro cracks from the clenching. So if you know that you're clenching, I highly recommend that you look into getting a protective guard. I say this is the best insurance policy that you can have for your teeth. Why? Because I place dental implants for a living, and I see a lot of patients that actually crack their teeth. It could be a virgin, totally perfect tooth. It can be cracked right up. There's no solution. I'll have to replace it with an implant. So clenching and grinding can be very expensive and painful. So the best way to really prevent it is really with a mouth guard, or for some people who are clenching during the day, it's a day guard. Whatever it is that we can protect the
Thank
teeth.
you. What kind of considerations what should people consider if they are a candidate for an implant? What kind of questions should they be asking their dentist or their periodontist before making a decision about implants?
Yeah. So that's a great topic because, for the longest time, all we had available is titanium implants, which are metal based. And I was trained how to place titanium implants. But in the last 10 years, we had more and more studies coming out that people with autoimmune disease can have a reaction to metals, especially to the titanium ions, which can come off in a wet environment, like the mouth, can come off the implant body. Ceramic implants have been around now for about 25 years. So I'm placing more and more ceramic implants for to have a metal-free option. And nowadays, ceramic implants are just as good as titanium implants. So for those of you who have autoimmune disease and you think, yeah, oh my God, I cannot place implant, because they're metal, that's not true. We do have ceramic implants. And part of my role with Noble Biocare on the advisory board is to educate people on ceramic dental implants because a lot of people don't even know they're available as an option. So definitely look into that.
Okay, great. Thank you. What is your take on critical supplements like vitamin D?
Vitamin D is one of the most important and my top three go-to supplements for every day. There's been a lot of studies with vitamin D and the mouth. What we know is that the higher the vitamin D level, less periodontal or gum disease. Higher vitamin D, less cavities. Also, the higher the vitamin D level in your system, less teeth you're going to lose over time. So that's one of the things that we test for here in our practice. We use a blood spot test. It's a finger prick. We put on a blotting paper, send it out to the lab. We must know what your vitamin D level is so you can take the right recommended level. So we're looking really for a blood level of around 80 nanograms per mLs.
Okay. What, in addition to vitamin D, what are your other top two favorite supplements?
Vitamin C is another one that I love, and you can get that naturally. By all means, you do not need to necessarily have it in a supplement form. So if you're eating like fresh vegetables or fruits, then you're going to get your recommended vitamin C level. And the third one, I would say it's omega-3 vitamin E combination. And really, there's so much information now on the importance of keeping the cellular membrane fluid and flexible. So that's one of the reasons why I like it.
Awesome. What are some of your recommendations for people who are interested in combating sugar? What do you have any favorite tips or tricks that you recommend? Being that you have such a significant background in nutrition, so tell us what you think about sugar.
Well, sugar causes cavities for sure. In my book, Heal Up, I mention different alternatives, how we can wean ourselves off of sugar. And I myself was a sugar addict when I was young. And I had a whole bunch of cavities. That's how I ended up with a bunch of mercury fillings in my mouth. But at the time when I grew up, we didn't have any alternatives to sugar. Basically, now what I recommend to people is definitely xylitol, something that's a sugar alcohol, so non-GMO birch-based xylitol, or erythritol is another one from the same family. And these, are not inflammatory. They don't cause cavities per se. As a matter of fact, in Finland, xylitol has been shown to significantly decrease the rates of cavities for patients. So the way I got off of the sugar is really substituting sugar with something else that's sweet. Monk fruit is another great substitute. I'm not a big fan of stevia because of the aftertaste. So sometimes combining stevia monk fruit or stevia xylitol is a little bit better tasting. But there's so many great alternatives today.
Those are great suggestions. Speaking of sugar, now people are kind of traveling again. So do you have any recommendations for people who are getting on an airplane and they want to, maybe they're going on a long trip, they'd like to avoid sugar, or at least have some healthy food while they're flying? Any best practices for consideration of your dental health and your overall health when traveling long distance?
Yeah, definitely follow the 3 steps to optimal oral health. It's easy to travel nowadays with a water flosser, your brush, and a chewable probiotic. Another thing that I love and I always travel with is something that's ozone related. I'm a big fan of ozone. We use it in our practice pretty much in every operatory for every kind of situation. Ozone is basically a sanitizer, but it also primes our immune system to work better. So I travel either with ozone oil that you can easily use, anywhere you want, whether you have a scratch, whether you have a gum inflammation, whether you have a sore throat, or nowadays there's these ozone tumblers. You can actually make ozone water on demand, and you can spray your countertop, you can spray your mouth, so you stay healthy that way, and also protect your immune system.
That's awesome. Um, will you talk to us a little bit about some of the non-invasive laser technologies that are available today in both dental and the medical space as it relates to anti-aging and people who want to look younger, feel better? What do we need to know about this space?
Wow, I mean, lasers just in general have really like revolutionized not only dentistry but also anti-aging, like pain and inflammation. We use so many different kinds of lasers in our practice. From cutting lasers during my surgery because they do create a lot less inflammation. From lasers that help with people that have pigmented gums, like brown looking gums, we can actually take off that pigmentation just like the same way we do on the face. We have cold lasers that help with the healing. For TMJ, for example, people suffering from migraines, we use those cold laser also, and as a nice side effect, they help improve collagen in the face, in the TMJ area. And it's a major part of our practice.
That's good to know. What's your perspective on for people who are concerned about having a beautiful smile? What's your perspective on eliminating toxic relationships from your life?
Wow, toxic relationships. Yeah, definitely. Well, toxic relationships can only make somebody clench. So I'm not a big fan. Oh, yeah.
Don't clench, you guys. Don't
Don't
clench.
clench. No, it's not worth it.
Yeah. This has been so sorry, go ahead.
I know you were asking about keeping like a beautiful smile. Keeping white teeth has really to do with eating a lot of fiber, less chemicals, hydrogen peroxide. If you really want to whiten your smile, it's a great way to go. But the less you do, the better. The less you drill in a tooth, the healthier it will be. So, yeah.
How would you recommend if people are curious about what you just said regarding hydrogen peroxide? How would you use it appropriately to support a healthy, wider smile?
Great question. The best way to do it is in a gel. There's all kinds of like almost like little lipsticks, but they're used for teeth. It's a gel that contains about 3% hydrogen peroxide that's safe to use. And you can literally just paint it on your teeth, let it sit for 1 or 2 minutes, and then just brush it off. That's a great way to maintain a bright white smile
Do you,
outside.
do you recommend teeth whitening, specific teeth whitening toothpaste, or generic strips that might do something similar? What's your perspective on those?
Whitening strips can work really well. The only problem with them, you don't get in between the teeth. That's the only thing. You only like go to the outside. So really to get the in between the teeth, you can use the pen that I was mentioning to get the in between. Of course, going to a dental office and getting a whitening treatment is always going to be more profound. However, we need to find the ones that are less sensitive. So the technology has changed a lot. We use something in our office called TheraSmile, and it helps to protect the enamel more than our previous systems. But still, just don't overuse it. Whichever whitening system, whether it's like strips, whether it is a pen or the in-office whitening, don't overuse it. That's really my best advice because just like anything else, you overuse it, you're going to end up damaging the surface of your tooth.
Okay. What are some of the biggest misconceptions about dental health that you wish you could change?
That's a great question. I think the one of the biggest misconception is we have to kill all bacteria. Our mouth must be sterile. We brush really well to get that bacteria. It's not like that. On the contrary, we have to nurture the friendly bacteria. That's really how we have to look at it. Mhm.
And what's your recommendation, in addition to what you've already shared with us? Is there anything else that you would say is critical in terms of nurturing that good bacteria that will support, a healthy biome in your mouth, in your gut, in your brain, like throughout your body? What do we need to know?
Eating a healthy diet is you cannot replace that with anything. So if you're going to have fresh fruits and vegetables, especially less fruit, more vegetables because fruits are still sugar, and having a lot of fiber in your diet will help keep your teeth healthy and your mouth healthy. Very, very important. Naturally fermented foods are also a great part of a healthy mouth and a healthy digestive system. And keeping a mouth that's infection free, like checking on your root canals that might be maybe going bad, looking at areas in the jawbone where you might have bacteria hiding, getting control of gum disease, or having fillings or caps that fit well around the tooth. All these things minimize the way bacteria like to hide, and they're opportune organisms, so they'll find a place to hide if you give them one. So have your regular checkups with your biological dentist in your area, and eat a healthy diet.
Sanda, for folks out there that don't know, will you explain the difference between a dentist and a periodontist, and if people are looking for somebody with your level of expertise, what kind of questions should they be asking when they're interviewing a talent such as you?
Great questions, Jessica. So I'm a periodontist. So what that means is after I finished my dental school, I went to UCLA graduate school for 3 additional years, and I studied the microbiome of the mouth. And my master thesis was actually based on regeneration of gums around teeth. Um, so as I finish the program, my main focus is to get a healthy microbiome for patients to minimize the bone loss around teeth. I place surgical dental implants with that extra 3 years of studies that I've done. So past my periodontal specialty, I became a biological periodontist. So what does that mean? I work in conjunction with the body to make sure I don't introduce artificial bone grafts, for example, which are actually very common. I work more with natural bone, more with stem cells from your own body, instead of using foreign material that could potentially create a trigger on your immune system. If you're going to find a biological dentist or biological periodontist, there's a few things that you must ask them. Number one, do they use ozone in their practice? In my experience, it's really changed the results that I see on patients. Secondly, do you use fluoride in the practice? If somebody's using fluoride in their practice, you know they're not a biological dentist or periodontist. They can't possibly be if they really understand what fluoride does. And thirdly, do they do biocompatibility testing? In our practice, before you have dental work, fillings, crowns, materials, we offer a blood test that kind of shows us how your immune system will react with 600 different dental materials before we put them in your body. Because we know that whatever we put in your mouth can have an effect on your immune system. And this shows up as chronic fatigue, brain fog, or even just gum inflammation after you had a cap placed. So we try to take every precaution so that we respect what your body can and cannot handle.
Such powerful information. This has been so great. Thank you so much for your time today, Sanda. If people want to get in touch with you, if they're in your area, will you share with them the best way that people can follow the work that you're doing, learn more from you, and potentially even come and get treatments from you?
Definitely, I would love to hear from you. I have a YouTube channel and I constantly place information on oral health and biological oral health for that matter at Ask Dr. Sanda. Also, you can send a question on Instagram at Dr. Sanda, and Beverly Hills Dental Health. You can check out about the different biological services you can expect to find.
Awesome. This has been so wonderful. Any final words of wisdom or advice for folks out there who are really passionate about protecting their teeth as they age?
I want everybody to know that using a biological dentist to just look at a thorough view of the mouth is of utmost importance. If somebody, wants to just drill and fill your teeth, you're not in the right place. So I hope you really find somebody that you can trust and that can, preserve your smile for your whole life. That's the goal.
Thank you. Thank you so much. This has been such a pleasure. If you guys would like to check out Carbon 60, you can visit us at shopc60.com, and you can use the code the C60 show for 10% off your first order. If you like this content, please make sure that you like, subscribe, and share it with a friend. Thank you so much, and we'll see you next time.